Okay, so a very nice question is asked today, that whether we can give ringer lactate in patients of liver failure or hepatic failure. So why this question? Because we are worried that if we give ringer lactate, which contains lactate ions, if we give this to patient of hepatic failure or liver failure, it will cause lactic acidosis. Can it be harmful to the patient? So understand that in a patient with normal liver function, what this happens to this lactate ions. So these lactate ions can get metabolized by the liver and they are converted into bicarb. So they are little bit beneficial and they increase bicarb. So little bit of alkalosis is there, which is sort of beneficial. It's sort of act like a buffer. So, but if the liver is not working, so liver is not able to metabolize the lactate ion. So, will this affect will it be detrimental if we give to a patient of liver failure? So, understand that the ringer lactate usually contains 28 millimoles per liter of sodium lactate. It is not lactic acid. So, giving that sodium lactate in a patient of liver failure will not cause lactic acidosis per se. It will not cause lactic acidosis. The associated ion with it is sodium, not the hydrogen ion. So, it will not cause lactic acidosis. But whether it can increase the measured lactate in the blood, yes. So this lactate will cause rise in your measured lactate, which is your in your ABG machines, or ABG will read a rise in the lactate level, and this will confuse us whether the liver functions is getting deranged or this is because of the ringer lactate. So you need, if we are giving, you need to have a little cautious in reading these lactate levels. So what will the scenario? So next time you just try this in your ICUs. Whenever if you are giving or happens to give ringer lactate in a patient of uh, liver failure, in your ABGs, it may happen that the lactate may increase a little bit, but it will not increase the lactic acidosis. The high anion gap metabolic acidosis will not occur, will not increase, but there can be a slight increase in the lactate level, which can be confusing. Also, how do you monitor whether a liver functions in improving or not improving? So that it can confuse. But yes, the answer is, if you can, if whether you can give ringer lactate to liver patients, yes, you can give. There is no harm in it. But because there are no studies per se which have done on that, some studies even have showed a little bit of benefit of this. So whenever you search the data, it will say that it is not absolutely contraindicated. You should use with a caution like that. There is a very good article on deranged physiology. You should read about this ringer lactate solution. I hope this clarifies. Do read more about it.